Good morning, Tania. Thanks for joining me for this interview for the Fizzy newsletter.
Thanks very much for the invitation.
So, Tania, you've had a really fascinating career working to both respond to and prevent violence against women and children. 9 years in VicPol in really interesting responding positions at VicPol, then 4 years working for the UN, leading their work around responding to violence against women and children, and then back to Victoria and about 4 years again in leadership roles, significant leadership roles in the Victorian Public Service. And you've been in this role now as the CEO of the merged entity of DVVic and DVIRC for just over 6 months now. And I'm really curious on that basis to hear what it is. So you came into this role in an incredible time, in the middle of a pandemic last year, having been overseas and then in government. What is it that you noticed? What is it that you noticed has changed? What were your observations about the impact of the pandemic on the sector? And what are your thoughts about what things we need to hold on to from that?
Well, I guess firstly I should say that I arrived in Victoria post the Royal Commission into family violence. So already the landscape was changing in relation to the responses to family violence, both the prevention and response to family violence. So I think, at that point we were going to see such a fundamental change in both the investment as well as the approach to how we were going to build the system for the response. So then when I came into this particular role, obviously during the pandemic, there were a few things that I noticed straight away, and that was the ability of, particularly as I was working in the specialist family violence services sector, the ability of the services to pivot to technology provided solutions, to be able to continue engaging with victim survivors in every possible way, but through the use of technology, and the ability to move quickly to those other platforms was really quite remarkable, I think. It was also, in the peak body, I really noticed too the engagement we were able to have too with rural and regional services, having finally provided that technological platform for them to sort of come in and meet with us on a more regular basis. I think one of the other things I saw during the pandemic as well, and certainly based on information from our member services, was, the increasing engagement on family violence by family and friends. So increased third-party reporting, which is really interesting because I think that's probably reflective of the cultural change we've had in Victoria over the years. Yes. About raising awareness and a whole, that it's okay to talk about family violence, a whole range of things. I mean, we're not there yet, but I think you can see that there's been a significant change. I think some of the, and I think all those things are great. There's some of the things that we might want to keep, particularly as we have to pivot between, stable kind of conditions for providing services versus less stable or more insecure times where we have to, sort of be locked down and provide services remotely. So I think they're good things to keep, of those changes. But I think some of the other things that we really noticed, I think, during the pandemic, and things that it's really important to address, I think, going forward, are perhaps some of the deficits in funding for specialist family violence services as well, due to the increased complexity and demand of the system that's been raised by, the whole range of things that are influencing, outcomes for victim survivors. And I think that and the other thing was also seeing I think the staff capacity, because that there is, there's quite a growing industry, but there's, we still haven't got the workforce capacity that we need in the family violence sector. So people working really long hours, working from their homes, no separation from the professional and the personal, I think has a huge toll on the sector. Certainly we're a gendered workforce as well. And so, having to also perform take up the care of children in the home, the schooling. I think it's pretty clear that fell to women during the pandemic. So all of those impacts, I think, are really significant for our sector. So I think, though, one of the things moving forward, like I said, I think technology is really important, keeping friends and family engaged, but I think we have to address some of the structural deficits for services to be able to provide their services in, being funded for, adequately to not for frontline service delivery, but also for all the extra work that they have to do to maintain their services, which includes technology and a whole range of operating costs. And I think we have to get the balance right between maybe face-to-face service delivery as well as what we can provide remotely to ensure that we have the broadest reach possible for services.
It's been a really challenging time, and it really has highlighted some of the structural issues within the sector, hasn't it? And I think it's been a very rocky start to 2021 as well. I think going into that third lockdown really shook people up, and one of the things I observed because of that was just the fragility that was remaining from, as you said, the pressure that people have been under. So given we're kind of moving, we're at the start of 2021, what are the things that are really important and your priorities for this year?
Yeah, I guess I got a few sets of priorities. Well, the first one, as you mentioned, we're merging two organisations together as the peak body. So we're bringing the resource and training area of DVRCV together with DVVIC as the peak body and providing a much broader suite of services for our members, which will be great, as well as the work we do on primary prevention, which will be really good. So finalising the merger and making sure that we keep our people well and supported through that process, I think is a real priority for me. The second one is going back to the issue I talked about, workforce capacity and the commitment the workforce has shown over COVID and what it's meant for them personally. I think we really have to prioritise health and wellbeing for members of especially specialist family violence services, and parallel to that, increasing the workforce capacity so that we can have people take their leave when they need to take leave, and that we can have more distribution of effort across the specialist services. So I think working with government to build the capacity of the specialist family violence workforce is a huge priority for me, and I'm sure for the member services. We need more practitioners, and we have to have good attraction and retention options, I think, to make sure that we get people who not only have the passion but are willing to work in the sector. I think definitely increase in funding for specialist family violence services to meet not just the demand, but to create that operating environment that they can fully function in, some of those, making sure that they've got the right technology to provide the services. They can collect the data they need to collect to be able to demonstrate the evidence of impact and all of those things that you have to do to keep your funding sources viable with government. So I think that's a huge issue for me. And I know, and you have to commend this government. There's been huge investment in the family violence service system and the creation, or the start, I will say, of the creation of a system. I don't think we're there yet, but we're trying to build a systemic response. But we've certainly seen a lot of funding go into the triage and assessment component of the service delivery model. We need commensurate funding for the case management and recovery of victim survivors, or else we won't see the full effect of the reforms, I think, come to fruition. And I think the last priority, which is really important too, is I really would like to give effect to this idea that family violence is everyone's business. I think we really have to work hard to not only raise awareness, but provide enough information and resources for family and friends to support people who they're worried about might be exposed to family violence in a safe and practical way. So I think that that's a really important thing that, you know, the peak can really contribute to.
That's a big agenda, Tania, and it's really good to see you in the leadership role bringing together those fabulous organisations that have such a depth of history and expertise as part of the background for those. So, and we're really keen to support you with that. I think that it's great the leadership role you played in bringing together groups to further that agenda. So all the best with that, and look forward to working with you more as part of the FISI partnership we have with DVVIC.
Thanks, Micaela. I look forward to it as well.